And as usual, we'll start with the numbers of COVID-19 disease, corona. Worldwide, it's been registered 69,242,431 cases. Death rate, the total death worldwide is 1,576,103. In Oman, the confirmed cases yesterday, 197 cases, which takes our total to 125,669 cases. Those who passed away died yesterday, 2 individuals. The total number of deaths is 1,463. Those who recovered is 117,327, and that takes the percentage of 93% of the cases. The number of patients in all our critical care units, the Sultanate, is 65 patients. And the total number of admission in all our healthcare facilities, the government and the private sector, is 135 cases. As you noted, over the last 6 weeks or so, luckily our numbers are coming down, and there are several reasons for that. But one of the main reasons, you've been wonderful, honestly, and that's why I'm smiling more today. You've been doing the right thing. You've been wearing the mask where it needs to be worn, basically. And I need here to mention, and I will mention this in Arabic later on to my colleagues from Royal Oman Police. You don't need to wear the mask if you are walking alone somewhere. You don't need to wear the mask if you are driving your car alone with your family. But please, any places where there's gathering, shops, government offices or private sector offices, it is a must. It's the best protection we have at the moment. Wearing the mask, keeping your physical distance, and of course the hand hygiene and the respiratory etiquettes. You've noted also that the Supreme Committee took decision to open almost all activities, commercial activities. And this decision was not easy. And we've seen and we learned from what happened in countries in Europe and elsewhere after they opened businesses. They had the second wave, which was in certain countries more severe than the first wave. We hope that would not happen in Oman. And the main reason to prevent that, again, we don't want the message to reach people in Oman that we open everything, that means the disease is away, the virus is away, or the virus becoming weaker. No. Unfortunately, the virus is still with us. The virus is still spreading when it gets a chance to do that. We still have patients in ICU. I've mentioned in Arabic one example of one of my colleagues. His father and mother were in ICU at the same time. Can you imagine you have both your parents in a critical care area, unit, where you cannot visit them, you cannot see them, you cannot talk to them? I don't think any of us can even imagine how difficult that is. And that can be prevented. We can stop this disease without the vaccine, which we are awaiting patiently. But we can stop it. We can reduce the cases. Let us just work together, feel the responsibility, be responsible. None of you intentionally want to pass this disease to anybody. We know how many lost their loved ones. We know how many spent in the critical care units, and they still suffer from the consequences of COVID-19. So it's all in our hands, and literally in our hands and nose and mouth. So please continue doing the right thing. We always talk about the frontline worker, who are the healthcare staff. They've been exhausted. They've been working around the clock, and we are grateful to all of them, and the supporting services as well. They are the front line, but also they are your last line of defense. What I would love to see, for you to be the front line, to stop this disease. Because if the last line of defense collapsed, la samahallah, God forbid, we are not in a good shape. And that's hopefully will never happen. So please, all what we gained so far, because we work together, We did the right thing. Let's continue doing the right thing. You've heard Her Excellency, the Undersecretary of Tourism, Heritage and Tourism, about opening Oman for tourism, and it's a welcoming country as usual. And also you've heard my colleagues from Royal Oman Police, the announcement that there's 103 countries don't require visa to come to Oman, with certain regulations that I'm sure it will be in their website. I urge you to contact these organizations if you have any specific questions. Let me mention also about vaccines, since I'm sure there'll be so many questions. Vaccines are good, but they are not the answer yet. We'd love to have enough to vaccinate everybody, but no country can do that. Not because of financial reason, because of logistic reason. Companies cannot produce enough for all of us, 7.5 billion worldwide. In Oman, we managed to secure a certain number of doses of vaccines, over 2.2 million doses, but they will not come today. They will not come tomorrow, unfortunately. They'll be spread across next year. The technical people at the Ministry of Health, like any other country, they put criteria, priorities, who are going to get the vaccine as priorities. And it's something that's adopted worldwide. Of course, the frontline staff, whether in healthcare or other services, they will be priority. But also, our priorities for the elderly who are having chronic diseases that can make the COVID-19 life-threatening for them. And I will mention diabetes, chronic kidney disease, and patients with chronic respiratory illnesses. These are very high-risk factors for severe illness and death. The question is also, is the vaccine going to be available in the private sector? We are working toward that. Depends how much we can get. And we had a meeting with the private sector healthcare, and they know what to do when we get the vaccine. Would it be available for people to buy? Yes, when we have enough cases. I know certain countries will make it compulsory for you to have the vaccine before you travel to them. Therefore, for those who are on the priority list, the vaccine will be free of charge for our priority list, but we will try honestly to secure enough doses for people who would need the vaccine for traveling purpose or other purposes. Go back to the vaccine. Please also don't listen to the rumors. Vaccines are one of the best, if not the best, public health inventions since medicine started. It saved millions, hundreds of millions of lives over decades. And all these rumors about these vaccines and their safety, we will never allow any vaccine in Oman before it's registered at the country of origin, because before we know its safety profile in addition to its efficacy profile. So I can assure you, your safety and the safety of these vaccines are our priority number one. But again, we need to understand that there is no intervention. Vaccine, other medication, doesn't have the potential for side effects. But these side effects are minimal compared to the consequences if we don't take the vaccine. So don't listen to what has been in the social media about this vaccine and the number of deaths here, the number of these are not founded. Please try to get your information from the right sources. Stay safe, keep your physical distance, keep wearing your masks, and no gathering. I know there are festive season coming for many people in the country, and please remember, gathering is still not allowed outside the household family and immediate families, as long as they keep their distance. But the gathering is still not allowed, and you can celebrate, you can enjoy yourself in being 1.5 meters apart, wearing the mask when you don't need to take it off for eating or drinking. And when we say keep your physical distance, we do not mean do not talk to your loved one, to your family members, to your friends. You can do it. There are so many ways of communicating now. I wish you all well, and I hope the time will come when the whole world will get rid of this virus and we will go back to at least semi-normal life. Unfortunately, that doesn't seem to be very soon, but we are all very optimistic that with number of vaccines going to be in the market next year, things will be better.